Hi everyone, my name is Mahrukh. I'm a fourth-year honors student in the Faculty of Kinesiology. Today I'll be presenting on the evaluation of the I Can Walk app as a walking aid teaching tool for medical students. Walking aids such as auxiliary crutches, canes, and four-wheeled walkers are used by millions of Canadians to promote independent movement, especially individuals with any musculoskeletal or neurological impairments. However, with increased walking aid use also comes the prevalence of improper use that may lead to upper limb discomfort, pains, and falls. So, how do we prevent improper use? Well, first, we need to identify why that occurs in the first place. Our lab has identified two key issues that lead to improper use. The first is inadequate fitting of walking aid to an individual's personal traits, such as height, and the second is the inadequate gait training with walking aids. We also find that physicians may receive little education on walking aid fitting and use, which may contribute to a lack of patient knowledge about walking aids. And so all of this creates a need, and that need is for a standardized walking aid teaching tool. To address this, our lab created the Improving Canadians Walking Aid Skills, Learning, and Knowledge app, or short for I Can Walk. I Can Walk is an interactive video-based app that teaches healthcare professionals how to fit and use walking aids such as auxiliary crutches, four-wheeled walkers, using a peer-to-peer design. Here's the app itself. We have 20 different modules to choose from. On the left, you can see the different fitting and walking modules, and on the right, you're able to see all the different walking aids and their associated fitting modules. Once a module is chosen, it is an interactive video-based learning environment where you're able to take a video to compare it side by side with a best practice video. So here's an example of a best practice video on the top, and then in the peer-to-peer setting, a participant will take a video of the other person performing a similar movement as seen in the best practice video, and then be inserted underneath the best practice video. Participants are then guided through a self-assessment with their video and the best practice video side by side, and participants answer component-related questions with a yes, partial, or not yet. Through all the different components that are required for proper fitting. At the end, participants are given a summary assessment score with all the different questions relating to proper fitting and all their answers, and a final score for them to identify any areas that they might want to improve upon and areas that they might be doing really well in. So the objective of my project was to evaluate the usability of the I Can Walk app as a teaching tool for medical students. We had 20 medical students from the Cummings School of Medicine participate, and they came in groups of 2 using the interactive peer-to-peer learning environment of the I Can Walk app. In terms of measuring usability, we used the standardized system usability scale, which is a 10-item questionnaire, which positively and negatively phrased questions, and participants responded using a 5-point Likert scale. The scale ranged from 1 to 5, with 1 being strongly disagree and 5 being strongly agree. The positively phrased questions were odd numbered, and there was something like, I would like to use the app frequently. And the negatively phrased questions were even numbered, and something like, I would find the app unnecessarily complex. And participants would respond using this scale. These questions were staggered one after the other to eliminate any bias and to ensure the participant is paying attention. So we had 20 medical students participate in our study, and from the system usability scale questionnaire, we had the positively phrased questions answer range from 3.8 to 4.4 in mean value, which falls in the agree category of the 5-point Likert scale. The participants found the app easy to use and they felt confident using it. When looking at the negatively phrased questions, we have the mean ranging from 1.5 to around 1.8, meaning that they disagreed with the negatively phrased questions about the app, that they didn't think that the app was unnecessarily complex. So overall, we used the positively and negatively phrased questions and compared it against the standardized system usability scale to find a total value of 80.6 with a standard deviation of 12.3, which corresponds to the excellent category on the standardized scale, or the 90th to the 95th percentile in app technologies. So what does all of this tell us? Well, in terms of measuring usability, the I Can Walk app was seemingly easy to use, and medical students felt confident using the app. And this may be suggested that the app is an effective teaching tool for medical students, and may suggest that the app may be used in a peer-to-peer setting to supplement medical student learning about walking aids to ultimately help their patients. We do recognize that these results are representative of a small convenient sample, and thus we'll be testing this with additional medical students and residents, and also try to integrate the app in Canadian medical education curricula. So in this small sample, the medical students reported that the I Can Walk app is easy to use and they felt confident using it, and it appears to be a valuable peer-to-peer interactive educational resource. These are the references I used. I would like to acknowledge everyone on this screen, and thank you for taking the time to listen.